All right, so welcome to the fall 2023 Sleep Apnea Support Group meeting. Before we begin, I just want to tell you a little bit about Lung Saskatchewan and who we are. So Lung Saskatchewan, or Lung Sask, was formerly known as the Lung Association of Saskatchewan, and we're Saskatchewan's oldest charity. We started out as the Anti-Tuberculosis League in 1911 and really have slowly grown to encompass all lung health. Our mission is to improve lung health one breath at a time. We do this through evidence-based education, research, health promotion, and advocacy. Today, we have an excellent team of sleep apnea educators and health professionals. We're going to talk about funding options for CPAPs and equipment in Saskatchewan. So I'm going to do a quick introduction to our presenters. We unfortunately lost Susan Clark, who was one of the sleep apnea nurse educators at the hospital here in Saskatoon at City Hospital, and she's unfortunately sick. But we do have Megan online here, and Megan Pegg is a registered nurse with a Bachelor of Science in Nursing and a Master's of Nursing from the University of Saskatchewan. She's got a background in pediatrics and neonatal intensive care nursing and has taught for the U of S College of Nursing as well. She's recently joined the staff at the Sleep Disorder Center in October of this year. So Megan will be our first presenter, and then we're going to have Elizabeth Ohitwa come on, and she's going to talk about sleep apnea funding for children in Saskatchewan. And Liz is a senior pediatric respiratory therapist, lead for the pediatric outpatients at the James Pattison Children's Hospital. So she's been an RT for 30 years and is one of the team members for the only pediatric respirology program here in Saskatchewan, based out of Saskatoon. Liz is the daytime respiratory therapist support for the JPCH Pediatric Sleep Disorder Center. Once Liz is done talking, I'll have some follow-up myself, Jamie Peters, with external funding options for CPAP machine and equipment. I'm a registered nurse and certified respiratory educator and been with Lung Saskatchewan since 2007. I have a lot of roles here. One of them is answering our helpline, where I mentioned earlier, I get a lot of calls about people needing some assistance navigating the sleep apnea health system, and among many other lung diseases as well. We have another special guest who's here for our question and answer period, and her name's Tamara Brissett. She is the Respiratory Benefits Program Coordinator for the Saskatchewan AIDS to Independent Living Program, so the SAIL program where the CPAP machines come from. She's worked at the respiratory depot there for 12 years, and prior to this, she worked in the private sector with CPAP and oxygen equipment and supplies. So just before I hand this over to Megan and Susan, I just want to remind you about a document we have on our LungSask website. And it's under Lung Health Resources. And this is just a really nice document that talks about all options for funding within Saskatchewan if you're struggling to pay for your CPAP or get funding through SAIL, or if you just don't have any health insurance. So there's some guidance in there that can give you a hand. And we're going to talk quite a bit about what's in this document as we go through the slides here. So I will pass that over to you now, Megan. And a reminder that Susan is not here.
Welcome, everybody. My name is Megan. I'm one of the sleep nurse educators at the Sleep Disorder Center here at Saskatoon City Hospital, and I'm going to be talking to you today about accessing funding for CPAP and CPAP supplies. So here with the SHA, we have a vision, mission, values, and philosophy of care. Healthy people, healthy Saskatchewan. We work together to improve the health and well-being every day for everybody. So that's something that we always want to remember. We would also like to acknowledge the SHA Treaty Land Acknowledgement, where we honor relationships with Indigenous people. We acknowledge that we're gathering on treaties 2, 4, 5, 6, 8, and 10, and the homeland of the Dakota, Lakota, and Métis. Recognizing this history is important to our future and our efforts to close the gap in health outcomes between Indigenous and non-Indigenous peoples by knowing what the land and the traditional people of the land offer us. So there are different options here in Saskatchewan for accessing funding. We have the government program Saskatchewan AIDS to Independent Living, or the SAIL program. There is provincial funding, federal funding, there's private insurance, as well as different options through private vendors. So I'm going to talk a little bit about the SAIL Respiratory Equipment Program overview for their CPAP machines. So equipment is available, but specific criteria must be met. The CPAP machine must be prescribed by a Saskatchewan-based respirologist for people 18 years of age or older. They must have completed a level 1 or level 3 sleep study here in Saskatchewan. And that's very important that it is here in Saskatchewan. A sleep specialist with privileges at a Saskatchewan Sleep Disorder Center, so here at City Hospital or Regina Hospital, for example, must be the one to interpret sleep test results and confirm the diagnosis of a moderate to severe sleep apnea. That's also important to remember, that it must be a diagnosis of a minimum of at least moderate sleep apnea or an apnea hypopnea index greater than or equal to 15. A client may also be prescribed CPAP by the medical director designated at a sleep disorder center if they have an immediate medical need or currently admitted as a patient in an acute care hospital. Exceptions are made for a diagnosis of mild sleep apnea, so an apnea hypopnea index greater than 5. For CPAP therapy may be prescribed for patients who have symptoms of sleep apnea and are in a high-risk occupation. So this would be at the doctor's discretion. Example for somebody who is a truck driver, a pilot, things like that, a bus driver. So there is a loan policy. The machine is available as a loan with the payment of a non-refundable program fee of $275. This program fee includes the loan of the machine and repairs for the useful life of the machine, which is considered 5 years. The loan can last longer than 5 years if the machine is in good working order. And we do find the machines often do last longer than this. The client is responsible for the cost of any consumable supplies. So this includes the mask and headgear, the tubing, the humidifier chamber when it needs to be replaced, as well as filters. So provincially, there is funding available through the Supplemental Health Benefits Program. This program provides assistance with non-insured health services to the following people, but please note it must be applied for. So government wards, inmates of provincial correctional institutions, residents of special care facilities who are eligible for the seniors income plan, and people enrolled in the following income support programs: the Saskatchewan Assured Income for Disability, the SED program, or Saskatchewan Income Support, SIS. So the client is able to get a CPAP machine through the SAIL program, although this $275 fee would be covered by the supplemental health benefits. The mask, tubing, and a supply of filters are also provided to the client initially and then once every year. There is federal funding available through non-insured health benefits, or NIHB, and the Veterans Affairs Health Benefits. With an appropriate diagnosis, the client may receive funding for CPAP equipment if they're covered under these two benefit programs. And in this case, the CPAP company communicates directly with the benefits plan. So for non-insured health benefits, or NIHB, the purchase may be covered if specific criteria is met. There must be a diagnosis of obstructive sleep apnea. There needs to be a recent prescription with pressure settings. Clinical information needs to be available. So the height, weight, Epworth sleepiness score has to be filled out, the symptoms of sleep disordered breathing, and any other associated risk factors. The sleep study must be interpreted by a doctor who is an expert in sleep medicine in Saskatchewan. And treatment with CPAP showed a benefit in a sleep condition. So often this is shown through a sleep study that's done here in City Hospital or in Regina. You come in and you do a level 1 sleep test where you stay overnight in the hospital. And then federally, there's also the Veterans Affairs Health Benefits Program. The use of a CPAP may be approved with specific documentation. So again, you need that level 1 sleep study. An overnight sleep study completed in a lab in Saskatchewan. Again, that's always very important that the test must be conducted in Saskatchewan. The diagnosis of sleep apnea or upper airway resistance syndrome must have been found and be interpreted by a specialist. Or a level 3 home study where you take the test home, then interpreted by a specialist that shows a diagnosis of sleep apnea. So there's also the option of private insurance if that is something that the client has. So if you do have private insurance, coverage will vary. Often there can be an annual limit. So for example, once a year, your company might pay for the use of a new mask, filters, tubing, or there might be something like a lifetime limit. You might be a certain amount of equipment at one time, potentially one CPAP machine per lifetime. That's just an example. Often you will need a prescription. So we try to make sure our clients get one and make sure you have one if you need one. Private insurance may only cover CPAP supplies as you're expected to go through the sale program. That being said, they may cover the one-time non-refundable program fee of that $275. Please check with your plan, especially before get those big expenses pre-approved. So now I'm going to talk about some private vendors that we have here in Saskatchewan. There's 5 specific ones I'll talk about. So there is Parkland CPAP. This company is located in Humboldt, Moosomin, Kindersley, Tisdale, and Yorkton. They do offer a payment plan for their CPAP machines, and they said that they're very flexible. They can spread the payments over anywhere from 3, 6, 9, or 12 months. They're happy to meet with the client and discuss different options that work best for them, but they do require a $600 deposit. For the consumables, the mask and headgear, tubing, and filters, the client is expected to pay upfront for those costs. Now, if you're under Veterans Affairs, Supplemental Health, or NIHB, they are able to work directly with those benefits programs, and the client will not have to pay. Sometimes there is a little bit of a wait. Another private vendor is Prairie Oxygen. They're located in Prince Albert, Regina, and Saskatoon. At this company, the client is expected to pay upfront, or there is an option to finance the CPAP machine through a company called iFinance Canada. They have brochures available within the business. You're directed to their website, and then I was told it takes about 15 minutes to fill out the application, and then you work with the company to figure out what payment plan works best. The interest rate that you will pay depends on income and credit score. The interest rate can be anywhere from 9.99% to 24%. It really just depends, and the payments can be made over a year. For mask, headgear, tubing, and filters, the client needs to pay up front. And again, they're able to direct bill if they're a part of the Veterans Affairs, Supplemental Health, or NIHB. So the next vendor is the Saskatoon CPAP services. They have 2 locations in Saskatoon. So the options for the CPAP machine are to pay up front, or the financing through Medicard through the iFinance Canada. So it's the same program. You go online and you apply. For the mask, headgear, tubing, and filters, you're expected to pay upfront. And same with the previous companies, they can direct bill for Veterans Affairs, Supplemental Health, and NIHB clients. The next vendor is Medigas. So there are locations in Regina, Saskatoon, and Swift Current. For this specific company, there are no payment options. It's just pay upfront for your machine, your CPAP machine, mask, headgear, tubing, and filters. They are able to direct bill for clients under Veterans Affairs, Supplemental Health, or NIHB. And then we also have Carica Health. So they have many locations across the province, including Estevan, Lloydminster, Moose Jaw, North Battleford, Prince Albert, Regina, Saskatoon, and Swift Current. So for a CPAP machine, there's an option to pay up front. And they also do have a payment plan through their own company. So they offer a 12-month interest-free loan. So they would be doing that through your credit card. So they would be charging the credit card monthly or for however many months it would within the year that you choose to pay off the loan. You can pay it off sooner if you're able and you want to. So for mask, headgear, tubing, and filters, you either pay up front, or if you're coming in when you buy your machine, you are able to add those payments at the same time if you buy your CPAP machine. So the first time you go and buy your machine, you want to get the whole works. They are able to add that cost all together and then put it over a 12-month interest-free loan. But if you already have your machine, you're coming in next year to buy replacements, the payment is expected to be upfront. They are able to direct bill as well for Veterans Affairs, Supplemental Health, and NIHB clients. And that is everything. And up next is Liz Ohiwa.
Can I ask one question before we go on? Because I'm not quite clear on it. When you talk about the payment system for the CPAP machines, that's if you're buying one privately, but not through the sale program through that private company, correct?
That is correct. Sorry, the private vendors, that is completely separate from the sale program. That's if you're going in and you're going to spend for example, $2,000 to buy the machine. Potentially you haven't, if you haven't, oh, sorry, I was going to say, if you haven't qualified, if you haven't met the criteria to get funding through the government, if you would like a second machine, if you were prescribed just a CPAP machine but you would prefer an auto CPAP machine, then that expense would be up to you. Or if you have mild sleep apnea, but you would still like a machine, then that cost would be on you as well.
And can the vendors or CPAP companies provide the sale machine at all, or would they have to send the results that they've done for testing off to the sale program to allow access to that?
Sale doesn't see any patients testing. If they do a level 3 sleep study through any of the private companies, all of that information gets sent directly to a respirologist in Saskatchewan that would then prescribe the therapy, fill out the sale form, discuss with the patient, and then the patient sends us the form. It's not done through the private vendors.
Thank you, Tamara.
Welcome.
Thanks, Megan. Great job. I will pass it, like she said, over to Liz.
So good afternoon, everybody. My name's Liz. I'm one of the pediatric respiratory therapists here at the Children's Hospital. So I strictly deal with people under the age of 18. And also, like Jamie had said, I am the daytime support for our pediatric sleep lab here at the hospital. So for children under the age of 18, CPAP and BiPAP, or as we kind of throw it all together, we call it non-invasive ventilation, is ordered through the pediatric respirologist here in Saskatchewan. Our funding sources available for pediatrics is very similar to the adult population. Ordering the disposables and other things like that are also through the private vendors as well. I'll go through some contacts for support, how we do follow up in pediatrics, and a little bit of information about our new clinic starting here in January. So like I said, the pediatric respirologists fill out the appropriate sale form. And there's also an AirView consent form that is filled out at the same time. The AirView consent form allows us access to the data out of the patient's device through the iCloud system. So when we go to start a new patient on non-invasive ventilation, we're always checking on the status of the health card to make sure that they have a valid Saskatchewan health card, or if they're covered under other funding agencies like supplementary health, family health benefits for children under the age of 18, as well as if they're a ward of the province, and then their treaty status, if they've got it. Because children are under the age of 18, they cannot sign the sale forms. So it goes to the parents for signing the requisitions. The funding program is explained to parents. And then the process of faxing to the sale depot for the equipment. And then depending on whether this child is in hospital or they're already at home, will depend on whether the device is shipped to their hospital room to get started, or it's shipped to the patient's home address. So when we order equipment through non-insured health benefits, when the patient has a treaty number, there's a certain amount of information that is gathered in order to have funding approved through that agency. So not only do we need the treaty number, the band name, the diagnosis, and the patient's date of birth. If they're under 1 year of age, we will then require the same information from mom or dad. And the patient is covered under one of the parents' treaty status until they're 1 year of age. And then they have to have applied for their own treaty number by 1 year of age. The request is then sent to the home oxygen supplier or a private vendor to process that request. So once the oxygen supplier processes the request, it goes to non-insured health benefits Regina branch. And then from there, it's forwarded to the medical committee in Ottawa for approval. So you can see that there's a little bit of a process here in acquiring equipment for this type of patient. It's usually at least 10 days up to 3 weeks turnaround time in order to get equipment through Indian Health Benefits. Once approved, the oxygen supplier will release the equipment to the patient. So they contact the patient directly for pickup of that equipment and education of that equipment. So funding sources, so we talked about the SAIL program already. It's a loans program to the patient for the duration that therapy is needed. When no longer needed, we ask the patient to return the equipment to SAIL. For NHB clients, typically a unit is loaned to them for the first 4 months. When the patient shows compliance by having the data downloaded, if this shows compliance, then NHB will purchase a machine for that patient. For those patients that have a treaty number, but something is not covered through the NHB funding system, we can go through another funding agency called Jordan's Principle. And that again is only for children that are under the age of 18. We also can access third-party insurance companies for items that are not covered through the regular agencies. And then for those patients of low-income assistance, there is some coverage through Kinsman Telemiracle and the Caring Breaths program, which Jamie will talk about here in a little bit. Prescriptions are written for all disposable supplies that are needed to go with the patient's device. Prescriptions are faxed or sent home with the patient to the home oxygen supplier. That provides the patient with a mask, headgear, filters, hose, and then told about sort of when to replace those particular items. For pediatric patients, they're told to replace their masks, headgear every 6 to 12 months, depending on the patient and the lasting durability of the headgear, but also because the patients grow a lot more faster than obviously an adult does. If requiring replacement due to breakage, or if they're having trouble getting the mask to fit well, we ask that they reach out to the pediatric respirology team or their sleep company to help get a new system in place for them. So for support, if there's a breakdown with the unit itself, we ask patients to call the SAIL depot. And the number there is 306-655-2505. If it's a breakdown with the equipment through NIHB, the patient is asked to contact the private oxygen vendor that supplied their equipment originally, and they'll arrange for approval to get replacement for that particular piece of equipment. If the patient requires troubleshooting of their device or disposables, mask or therapy issues, we ask that they call the pediatric outpatient respiratory therapist. We're available Monday to Friday, 7:30 to 4 p.m. here at the Children's Hospital. And our phone number is 306-655-3084. We're happy to share information on mask desensitization, cleaning instructions, troubleshooting. We've got a great little pediatric sleep lab story that gives kids an idea of what happens when they show up to the sleep lab, as well as the Magical Mask storybook, which is a great little cartoon story that helps the child adjust to their new therapy and talks about the mask and the machine in that little story as well. And follow-up. So follow-up is done by our pediatric respirologist, either in our respiratory clinic here in the outpatient department, or we do virtual appointments by phone as well. The respiratory therapist support and follow-up is provided as needed to the patient, depending on how successful their therapy is going. Patients' progress can be accessed by their care providers through the AirView app, and the patients can also see their progress through the MyAir app that they can download onto their phone or computer. So what's new? So starting in January 2024, we'll be starting a complex sleep clinic where patients will be able to come and be seen by a multidisciplinary team. The team may consist of a pediatric respirologist, respiratory therapist, members of our complex palliative care team, pediatric ear, nose, and throat specialists, clinical psychology, depending on the needs of that patient. At that appointment as well, we'll be assessing the therapy of the patient, compliance checks, mask fittings, troubleshooting, any sleep concerns the patient or family may have, and any behavioral issues or mental health issues that the patient is experiencing.
Thank you, Liz. I appreciate that overview. It's fairly similar, but often I think some of the people you're seeing are quite a bit more complex in their medical needs. I'm going to assume when the kids are that young and needing the non-invasive ventilation. So thanks for all the work you do.
No problem.
I want to just mention for follow-up, if you're being monitored as an adult for follow-up and you've been seen at the sleep lab, you would call Megan or Susan to talk to them about any of those concerns. But if you've been managed by any of the private vendors, you're going to want to call them to have the follow-up done there as well. So just wanted to make sure that's clear. And I wanted to get into now some of the other funding options that were mentioned a little bit, but there is quite a bit of people in the province who don't have a health insurance or who, are retired and can't afford the $275 loan fee. And so I'm just going to put out just a little bit more information on some of those other options that are there. So first off, if someone does not have insurance or other funding, you can actually give Lungs Saskatchewan a call. We do get equipment donations on a fairly regular basis, but they go in and out quite quickly. So we'll have some older CPAP machines, or not often a BiPAP. Sometimes they're an auto CPAP that'll be donated as well. And these are ones that have been purchased previously, and the owners do not need this service or need the machine anymore, and they get donated here. We don't do any service on those, so that would be the client's responsibility to take those to get either set up at the sleep lab or at one of the vendors, and there may be fees along with that. So if you are unable to finance with a vendor, don't have health insurance, you can give us a call and we can see how maybe we could give you a hand. Occasionally we have some masks. We were donated quite a few several years ago, so I have a few nasal masks available. No full face masks anymore, but sometimes they're donated, so always check back if you can't afford to replace yours. Obviously, the priority would go for people who don't have health insurance or cannot afford to purchase those directly on their own. And you can see the phone number for Lungs Sask there. I honestly don't advertise this a lot because we don't have a large supply. It's mostly by word of mouth. So you won't find a lot of this information on our website to give me a call because I would not be able to keep up with the demand. Some other options, if you are newly diagnosed with sleep apnea, but cannot afford the sale costs and the costs of a mask or tubing, Kinsman Telemiracle will assess you in their program and through their application process, and you can visit their website to see how to do that. Obviously, you'll have to meet their granting criteria, and it'll have to be at the right time of the year when they're doing their assessments for who gets funding and who does not. And that is only for those who are initially diagnosed. And then the Lungs Saskatchewan does have a Caring Breast financial assistance program. And this will possibly reimburse up to $500 per year for sleep apnea equipment that's not covered by your health plan or for Kinsman Telemiracle. It will not cover the loaner program cost. It will cover costs of masks, tubing, potentially setups, and the humidifier chamber. There's an application process for this also online with some information on the information that you'll need, a letter from your doctor, a letter of an invoice of what you've paid, and you can talk about any other sorts of possible application needs through that email and through our website. I don't think you saw this picture earlier. I'm not sure it showed, but this is the CPAP, BiPAP funding options for Saskatchewan residents we have on our website. And so if you want to get into some of those further details of what we talked about today, please go to lungsask.ca, and under lungs, there's a section called Lung Health Resources, or under sleep apnea, you will find this document there. The link was too long for me to add to here, so it's probably just easier to Google the link. And that is it for our talk today. So I am just going to unshare my screen. Oops. Stop share. And I'm going to